Hi, my name is Carson. I am a VIP medical esthetician. I work with lasers here, and we are going to be performing the Morpheus8 treatment today. So with her specifically, she's coming in for anti-aging overall. So we're working on fine lines, wrinkles, skin tightening, pigmentation. So if you see in here, the jowls area too, it'll pull that area in and fix within here. And then the neck, it'll help with pulling it in here because this is an area of concern for her. She lost a lot of weight, so now she has that loose skin that she's wanting to just kind of tighten up and bring everything together. The reason I recommended Morpheus8 for her was because this treatment would benefit her the most when it comes to skin tightening within the neck area, the jowls, fine lines, wrinkles, and any type of pigmentation. What it does is it uses microneedles and radiofrequency. The needles penetrate into the skin and create an injury, and that creates cell turnover, and that's what helps create new collagen and elastin within the skin. And as the needles go in, that radiofrequency bursts out underneath, and that's what will help pull the skin tight. She previously had this done on her legs and saw phenomenal results and decided that she wanted to do it on her face now because she was loving the results so much. We would never turn anyone away from this treatment. That being said, younger skin doesn't necessarily need this treatment because of its intensity level. I would maybe start with microneedling first before I would go into Morpheus8. But if you're noticing that you have that like thin, crepey like skin, fine lines, wrinkles, anything like that, then that's where Morpheus is really going to come into play and help just pull everything in. When it comes to younger skin, it tends to be more thick, which is why Morpheus isn't maybe the best first option that I would go with when it comes to deciding what treatment would be best. Once we are finished with the treatment today, I will be applying exosomes on her skin. What that does is that helps with the healing time, and it also helps with cell regeneration. It really just helps accentuate results, and after the treatment's done, the patients genuinely have a warm feeling towards the skin, and it also helps to relieve that warm feeling. I would recommend this treatment done once a month. You want to give your skin that 4-week time period to let your skin heal and let those cells regenerate. And even though that 4 weeks are up, your skin is still healing, regenerating new cells. You will see your peak results 90 days after your day of treatment. And because we recommend them in threes, 90 days after your third treatment is when you will see your peak results. We are done with the first part, which is the Morpheus8 treatment. My general recommendation for aftercare would be nothing on the skin for the next 24 hours. Tylenol is okay to be taken. No water or anything. If you have to shower, I always say lukewarm water and face away from the faucet. Make sure you have a nice clean pillowcase at night because you don't want any bacteria getting in your skin. And make sure you're staying out of the sun for the next week. You're wearing your sunscreen and kind of just making sure that your skin has a nice, healthy, open environment to heal without adding any outside factors in. And that's how I want your skin to get the best possible reaction. If you're using any topical vitamin C's, discontinue that for the following 3 days post-treatment. So I always say we have Silver Gel by Elta MD that's made for post-procedural skin and helps aid in healing. So I always say that is good to be used afterwards. Sometimes, depending on the patient, I'll say wait a couple hours or not. If they've had it done and I know that they don't have any adverse reactions, I say you can go ahead and put it on right afterwards. But usually if it's somebody's first, I want them to wait just to see if there is, so we know that it's from the treatment and not because an outside factor was brought into play. These are exosomes. They help with cell regeneration and they help speed up the healing process. So it helps relieve the redness after treatments. The skin usually feels very warm and has a lot of heat to it, and it helps relieve that feeling, and it helps overall accentuate the results of the treatment. We added on to the Morpheus8 because, like I mentioned earlier, those needles pinpoint into the skin, creating the injury, creating cell turnover. So it's all about creating new collagen and elastin. This creates new collagen within the skin, so it's a really nice benefit for the treatment. Thanks for watching. If you have any questions, make sure to leave them in the comments below. Make sure to like and subscribe, and I'll see you in the next one.